STDs or sexually transmitted diseases are caused by sexually transmitted infections or STIs. This is transmitted from person to person through sexual contact or intercourse. STIs are caused by bacteria, viruses, or parasites. A sexually transmitted infection may pass from person to person in blood, semen, or vaginal and the other bodily fluids. STIs don't always cause symptoms. A person can get sexually transmitted infection from another person who seems healthy and may not even know they have an infection. STDs can have a range of symptoms, including no symptoms. That's why sexually transmitted infection may go unnoticed until a person has complications or a partner is diagnosed. STD stigma is when a person with STD is judged by others. Even more judgment is not true or the information is not true. There are many stereotypes about what it takes to get a STD or sexually transmitted diseases. Like, you have a sex with a lot of people and you never use any protection. There are some symptoms that you can feel after exposures. Painful or burning urination. Painful urination is trouble or burning while passing urine. Fever. An abnormally high body temperature, usually accompanied by headache. Lower abdominal pain. For some conditions, the pain is localized to a specific site of the body. In other conditions, the pain can be felt in places besides the lower abdomen, usually the back. Rash over the trunk, hands, or feet. Syphilis usually causes a non-itchy skin rash, often on your hands and feet. Many people do not notice symptoms for years. Symptoms can go away and come back. Sexually transmitted infection symptoms may appear a few days after exposure, but it may take years before you have any noticeable problems, depending on what's causing the STI.
Sexually transmitted infections can cause lifelong complications if left untreated. Common complications from untreated STIs include the following. HIV can lead to AIDS. Syphilis can damage your organs, nervous system, and infect a developing fetus.
There are some ways to prevent STDs.
Abstinence obtains from sex. Not having sex is the most effective way to prevent STDs. Safe sex practices. Use condoms correctly and consistently use condoms during vaginal, anal, and oral sex. Testing and vaccination. Regularly get tested for STDs, especially if you have multiple partners. Get vaccinated against HPV and hepatitis B. Communication and education. Communicate with your partner. Discuss your sexual history, STDs, status, and protection methods with your partner. Educate yourself and others. Learn about STDs, their symptoms and prevention methods, and share this information with others.
There are some importance of responsible behavior.
When left untreated, STDs can cause a number of health issues including infertility, the inability to get pregnant. It can help reduce the stigma and isolation many individuals with rare diseases experience. Increasing awareness and understanding of these conditions can help create a more inclusive and supportive society. Awareness can help improve access to appropriate medical care. To see if you have STD, get a STD testing for you to get sure of what you feel.